Let's be honest, we all know what we should be doing. Whether we want to drop a few kilos, be more productive, or improve the quality of our sleep, knowing what to do isn't the hard part. The hard part is actually doing it and sticking with it. Do you want to know why? I'll tell you. My name is Shireen Skippers and I'm host and founder of For Your Life. For Your Life is a podcast all about habits. Join me as I talk to experts from all walks of life as we discover the power of habit and how you could use it to change your life. So if you want to change your life, change your habits. Habits are about time, and your time starts now. There's no sugarcoating this, but obesity in Australia is an epidemic. With 66% of adults now obese or overweight, we are the third most overweight nation in the world. And that's not just adults. Obesity and overweight rates are now 26% for under 17-year-olds, and it's not getting better. Even more alarming is that obesity rates have doubled in the last 2 decades. Obesity has now outstripped tobacco as the greatest contributor to Australia's total disease burden. And even although as Australians we are living longer, we are living more years in ill health, and this is largely due to poor diet and lifestyle choices. Here to talk more about this is Dr. Catherine Bacus. Dr. Bacus is the proud owner of Olivia Medical Weight Loss, which is Australia's largest and most successful medical obesity management clinic. She is relentless in her mission to help GPs overcome the challenges they face in helping their patients with obesity. Dr. Catherine Bacus, it is wonderful to finally catch up with you. It's really, really exciting for me to have you come on this episode today.
It's great to be here, Shireen, as well. This is a topic that's close to both of our hearts, so I'm really excited to dive in today.
Definitely. Thank you so much. So many questions to ask you, but we'll try to keep it focused. Right. And, as we always do with all of, as I always do in all of these episodes, I really want to leave people with the how, because everyone knows the problem. So. Yeah. Let's talk about you and what's, driven you to this career in obesity and helping patients.
Yeah, so I'm Dr. Catherine Bacus and I'm a weight loss doctor. I came into this area around 7 years ago when I was seeing a lot of patients who were living with overweight and obesity. And I realised, I started out thinking this is a lifestyle issue alone, and it's true that there is a lot of lifestyle components to this, but the more research I did, the more I understood that there is biology and genetics at play here as well. And so I was just inspired to help create change in people's lives, and they were coming to me with these health problems of diabetes and high blood pressure and sleep apnea, and underpinning that was weight. And we just wanted to kind of get upstream and treat the first problem so that we could help improve patients' quality of life. And it's just the most rewarding area of medicine. I love it.
Wonderful. So Olivia is one of the most successful and largest obesity management medical practices in Australia. And how did you grow? How have you grown it to that size? And
so I guess we started with just me 7 years ago. I was just doing 3 sessions a week, and now we have over 15 GPs. We've got 4 sites around Australia, and we just have a love for what we do. So I think we operate from a model of having evidence-based care, but compassionate care. And this is such an area where patients experience stigma, shame, judgment around their weight. And we wanted to sort of set out to say, hey, this is not your fault. There are reasons why this is a struggle. And here's some treatment options that are effective and that can really help you. And we're going to journey alongside of you with compassion and care. So I think it's not just what we do, but how we do it. That's made that difference.
Wonderful. And yeah, absolutely. That is so important. I would imagine that people suffering with obesity would experience a lot of, discrimination or ostracization.
So much.
Yeah.
So much. It manifests in so many different ways, such as lack of job promotions or being shamed at the pharmacy and told, what do you need this medication for? So many patients suffered in that area over the last couple of years during medication shortages, or not progressing in their careers, being thought of as lazy, and just that they must be sitting on the couch eating junk food in secret. That is not the case for many of our patients. They've actively been trying to look after their health and their weight. They've done, on average, patients have tried 4 to 5 weight loss attempts on their own before they see a doctor, and they often wait about 9 years. So this is not a group of people who are sitting there eating chips on the couch all the time. Wow. This is a group of people who have a biological condition where they, the environment that we live in is quite obesogenic, and we'll talk a bit about that because that's going to inform some of our habits as well, the environment that we're living in. So we want to make sure that we're treating it just like asthma or mental health conditions or diabetes. That has a biological component to it, and then there's also a lifestyle component to it as well.
Right. So let's talk a little bit about that. Of course, in Australia, we are really fast becoming one of the most overweight nations in the world, and obesity rates are going up, and not just obesity rates, but the number of, overweight people in the country, not only adults but children as well. What do you think are some of the factors that are driving that?
Yeah, I think, look, we've always had the same genetics. That hasn't changed very much. Some people are more prone to overweight than others are, and that confers a biological advantage. If you've got the ability to store energy, then you're going to survive a famine. Great for our caveman ancestors, not so great in 2025. But really, the environment that we live in has a lot to do with it as well. So our brains naturally seek high-calorie foods or reward foods. And then food manufacturers have figured out exactly what makes our brain light up, which is high fat, high salt, high sugar type foods. And then they're marketed to us. They're put on special at the end of every shopping aisle. There's some good changes happening in terms of how we set up our environments to promote activity and greenery in our new housing areas that are built. Promoting activity and exercise, but we've still got a long way to go in that area. So there are genetic causes, there are environmental factors, there's other factors such as mental health conditions that impact on weight as well, ADHD, anxiety and depression. There are weight-gaining medications, so certain classes of medications, some antidepressants, antipsychotic medications, some diabetic medications promote weight gain. So medications, underlying medical conditions as well, thyroid conditions, Cushing's, there's a range of other sort of rarer diseases that can cause obesity. So it's not just one thing. It's probably one of the most complex conditions around, actually, where there's a multitude of factors, including our biology and genetics, our appetite hormones, mental health, medications, underlying medical conditions, and sort of wrapped around in this environment that we're living in.
Fascinating. Yes, there's just no, single solution that can be applied. It's very, very bespoke and very tailored. So, describe to me your approach. How do you go about developing a program for someone?
Yeah, so I think one of the key things that we do is we work with the person to understand what are the causes for them. So we will spend about an hour with our patients at the start, and we'll do a body composition analysis to look at their muscle mass and their body comp. But really that first appointment is all about finding out about them. What are the genetic and biological causes here? What's the family history of obesity like? What's been the weight trajectory over time, so we can identify key times where there might have been weight gain. That might be during pregnancy or menopause are common times for women, or retiring for men. We look at the underlying health conditions that might be contributing to weight. What are their medications might be contributing to that as well. And understanding a person's relationship with food, because that's so important. A lot of people who've been trying to manage their weight all their life will have restricted their food intake, have quite an unhealthy relationship with food. So we really work on coming from a framework of abundance with food rather than restriction, but help with controlling hunger and cravings. And I think that's probably one of the key elements of our program, is if we can dial down that biological hunger, it's a heck of a lot easier to eat well despite the environment that we live in.
Really interesting. So let's have a chat about some of those potential medications and what effects those could have. How does it support the patient?
The medications have been a bit of a game changer for patients, actually. They talk about these medications dialing down the food noise, and there being less hunger, less cravings. So they typically work on the appetite centre in the brain to dial down that food noise. So a person feels less hungry, more full after a meal. They tend to decrease their cravings for sugary and high-fat foods. Even some people report having a decreased desire for alcohol. And by doing so, a person can naturally feel full after a smaller amount of food rather than needing a bigger portion of food. Those medications sometimes even do change the composition of the diet as well, where there is that tendency, away from those higher processed and refined foods, and the desire is then more towards, whole foods, which is really positive.
So, of course, everyone's talking about Ozempic and these kinds of medications, and we see anecdotally that they're incredibly effective. Would you say that the effects are? What are the effects after the medication is finished, like once a person comes off that medication?
Well, that's a good question. Should they be finished? Yeah. So these medications are really effective at dialing down that biological hunger, and that works as long as they're taken. But obesity is a chronic disease. In much the same way, if you think about a person who has high blood pressure, we might start that person on a high blood pressure medication, and when that's used, it works, and when it's removed, it doesn't work. The person's blood pressure returns to what it was. And the body's got this fabulous way of trying to return a person to their set point, unfortunately. Yes. Everyone who's done a diet before and had weight regain has experienced that phenomena. So, in fact, when a person loses weight, the body actually increases our hunger hormones and decreases some of those satiety or fullness hormones, and that's in the direction of weight regain. So that's important to know from a perspective of, it's not your fault if your weight has tended to creep up again. That's probably why, is that there's underlying mechanisms in the body to try and keep your body at a certain set point of weight. However, biology accounts for 40 to 70% of a person's weight, which means there's still a big chunk that's within a person's control. Yeah. And that's where habits and our lifestyle comes into play. The way we see it medically is that if we can support a person with control of their hunger and appetite, then they've got a much better chance of putting into place the right habits around food and exercise. So, yeah.
It's almost like getting that momentum kind of once you get started and you're seeing the changes and you're starting to feel good about yourself, and it becomes you're more motivated, I guess, to keep going.
Yeah, so. Definitely. And so when patients lose 10, 20, 30 kilos, they may not have felt much like exercising at the start. And in fact, it's sometimes dangerous because they can at risk of injuring themselves. What we do with exercise is we start patients off on some gentle exercise. And okay, let's start, if we've been doing nothing, might be walking to the letterbox and back, or walking around the house, or walking to the end of the street. So we gradually build up exercise over time. But the thing is, as soon as you start losing weight, you're like, great, I've got more energy, I can move more freely, now I really want to exercise. So it all builds on itself. Yeah.
So talk to me about some of the lifestyle changes that you've seen have been most effective with your patients.
Well, when it comes to, here's the nuance here. When it comes to weight loss, food is much more effective than exercise for producing weight loss. And that's because you can quite easily consume a lot of calories in a sitting, but it's quite hard to sort of burn them off. We always say you can't outrun a bad diet, right? We all know that. That's if weight loss is the goal. But what if health is the goal? Well, then exercise is helpful for every aspect of your health, our physical, mental health. It controls blood pressure, blood sugars. It's great for prevention of osteoporosis. So we really want to be focusing not just on the number, but on health improvements. So where we start with is nutrition, and we focus on looking at what sort of dietary approach is going to suit this patient. What are their goals? Do they want quick weight loss or a sort of slower weight loss regime? Do they prefer meal replacements or regular food? What have they tried before and what's worked? Has a ketogenic diet worked, or are they vegetarian or have some food intolerances or certain preferences? So our goal is to work on enjoying food, controlling portion sizes, trimming the excess, which is around, finding where those high calorie foods and treat foods are coming in and developing some strategies to reduce those. But basically it's about finding a diet that works for that person for life. And we kind of have a buffet of different dietary approaches that we can choose from, and then we'll work with the person to choose what's going to work for you to help you reach your health goals and your weight loss goals in a way that doesn't have you feeling restricted.
And what about, so we've spoken a little bit about environment. What about the family structure? Because, of course, people don't live in a vacuum. So I'm sure you've come across scenarios where the family are not supportive or, how do you deal with that?
Yeah, a couple of interesting scenarios. One of my patients told me about how his he was eating lots of high-calorie foods, some, lollies and chocolates. And then I said, tell me a little bit about, your environment at home. He goes, well, my wife has a tray of lollies and chocolates on the kitchen bench and I have to walk past that several times a day. I'm like, no wonder it's hard to control that. If that's staring you in the face, that's going to be enormously hard to refuse. So, and then other stories of patients who say, well, my husband and my son sit there and they pass, chips in front of me whilst we're watching TV. I'm like, oh, that's...
We need to address that one straight away.
So often I'll ask a patient, is your family supportive of your efforts to improve your health? And if they are, then you need to be speaking to them about, here's how you can help me. I'm really trying to focus on my weight. Here's how you can help me do that. Give them practical ways in which they can support you. The other big one is around the family meal and how to make that work for the person who's trying to focus on their health. And it may not be the top priority for everyone else, but gee, there's going to be some good benefits if, this person is focusing on their health and it's what the whole family embraces. So I'll often talk to patients around, well, let's adapt the family meal. Maybe it's going to be a spaghetti bolognese for you on some zoodle or some steamed broccolini, but maybe it's going to be on a big plate of pasta for your teenage son who's growing and needs lots of energy. So it's adapting, not making 6 different meals, but adapting the one meal to work for the different needs of the family.
Great. Yes, there's 6 different meals. Oh my goodness, I know. And once you start down that road, it's very difficult to. I often tell my children, I'm going back to 1970s parenting, where that's dinner, that's on the table. What you get is what you get.
You don't get upset.
Absolutely, yeah, totally. So I'm interested in when I was reading up about you, because I did do my homework before you came in. You talk about the challenges that a lot of GPs are facing in treating or supporting their patients in overcoming obesity or overweight. What are some of those challenges that you've seen?
Yeah, I think the first thing is that there are still some GPs who believe that this is a choice, that obesity is a choice. And I would say, is epilepsy a choice? Is depression a choice? It's not. There's really is a genetic component to this condition. And so it's about, one of my passions is to help educate GPs to understand the causes of obesity and how we can treat patients with empathy and care. So that's one of my big passions. So that's one thing. Then the other challenge for GPs has been around the time, in their consult. So lots of GPs are trying to manage every aspect of a person's health in this finite time, and it's really difficult because, as we know, it's such a complex condition. We spend an hour with our patients in that initial consult. How do you tease out all the causes and all the things that are at play for this person with their health and managing their weight? So time's a big factor. And then experience with using some of the weight loss medications and understanding the nuances of how they work, how to use them in a safe way, how to help patients, reduce some of the side effects. And that's where our kind of specialty clinic was born out of, is we wanted to dedicate some time to offering this specialised service and doing it in a way where we could support patients on that health issue alone and give it the time and energy that's needed.
Is there still some issues around getting access to some of these medications?
Well, so it has improved. So you mentioned a medication that was in short supply. So I'm obliged not to mention drug names.
The O word.
But with the O word, there you go. So there was a worldwide shortage of that medication because it was so effective. And then we had the release of the brand of that medication for weight loss, and that came out in August of 2023. So things have been a lot better. However, there are still 23 or 24. Feels like long time, might have been 24. And so that's improved the ability to access that medication, but the costs of the medication still remain a big issue. And at our clinic, we find ways to help patients to keep that cost down by using smaller doses of the medication from a bigger device. So that often helps.
So as we sort of move away from talking about the problem, let's look a little bit at the solution.
Yeah.
We've touched on a little bit of that. But if you look at your patients that have had success in really tackling obesity and keeping the weight off, what would you say are some of the common themes?
Yeah, I think we actually profiled which of our patients have the most success and looked at some of their common qualities, because I can tell you about all the effective treatments out there. But people in the studies, you can see that for any one treatment, there's such a wide variation in response to that treatment. And that reflects the complexity of obesity, but also, I guess some of the qualities that we identified in patients who do well are people who have a sense of control over their life. If it's things that just happen to me and I can't manage, then that becomes a bit of a problem. So self-efficacy is one of the key qualities. The other one is around compassion. People who have the ability to be compassionate with themselves and kind of flex if things don't go well, and not rather than self-criticise, to sort of go, hey, well, you know what? Had a bad day, I'm going to dust myself off and kind of move on, rather than all or nothing thinking. So when we've got flexible thinking rather than all or nothing, it's a lot easier to be compassionate with ourselves. Yeah, so self-efficacy, compassion and non-judgment, and having a sense of, control over a person's life, those qualities are quite helpful. And the other qualities are people who engage and are accountable. So, and I know that for some people, like, I've put on weight, or I've had a bad month, I'm not going to go and see my weight loss doctor. That's exactly when we can help people. That accountability also helps, because it's a time to share, discuss and tweak what's going on to help them keep going with their weight loss and their health.
And patience. I mean, I know that with some people that I've spoken to that have lost excessive, it takes years.
Yes.
Absolutely, yeah.
Yeah, that's
so to have the patience to keep going, and as you say, when you've had a bad day or bad week or bad month, just keep going, chip away, and eventually over time you'll get there.
Exactly. Persistence.
Yeah. Wow.
Yeah. Consistency and persistence, they're the other key qualities as well.
Yeah.
And I always say to patients, it's what you do most of the time that counts, not what you do once in a blue moon.
That's exactly right. And I love the whole idea of the compounding effects of small changes over time. And even although you may not see the change today, but you just keep doing it, and eventually when you look back over months, you're there. You're seeing progress, but you don't see it in real time. So it's hard to keep going if you're not seeing the immediate results.
Yeah, and I think that's where the focus is not on the weight loss per se, but on the changes in habits that lead to health benefits. Yes. So if we can make those changes in, food intake, exercise, our mindset, our sense of self-compassion, have help with hunger and control of hunger and cravings, all those things that are going to compound and lead to, most likely, really good weight loss. Yeah. But it's also with that's not the goal per se. It's on improving a person's health and well-being, and that includes mental health, which is why we don't like that sense of restriction, but rather how do we eat and nourish ourselves well, exercise so that we feel really good, and look after our mindset so we achieve that physical and mental health.
Right. So what are the recommendations you have for someone who is, right, I need to do something about my weight, I'm ready to make a start? What do they do? What are the next steps, I guess?
Well, they come and see us.
They come and see you, of course.
That's the natural answer. That's exactly what we love doing, because we love helping people to achieve their best health. And I think... so we can probably drop some links on the podcast if that's what people are looking for. So one thing is to get a doctor on your side, to get access to evidence-based and highly effective treatments within a support network. But if they're doing it alone, then it's really to start by looking at, where am I at now? What are my goals? What am I aiming to achieve in terms of my health? maybe we do a little bit of a assessment of their food habits right now and see where that's at. It would be good to sort of have an assessment of their body, their basal metabolic rate, and find out what their energy requirements are, to sort of see where we need to be sitting in terms of their food intake. To start with exercise, so start with movement. We say that something's better than nothing. So if you're not doing anything, let's start with getting moving. If you're already exercising, the gold standard is, doing some cardiovascular exercise 3 times a week with strength twice a week. And if you've tried that, because many people, this is not rocket science, many people have tried lots of diets in the past. If that hasn't worked and you're looking for some support, that's where our clinic fits in.
Fantastic. Do you have much exposure to children with obesity? Do you see kids?
We are a clinic for adults. It's a bit of more of a specialised area, but 25% of our Australian kids are living with overweight or obesity, so it's definitely an increasing concern. And there's already patients or children who are living with bullying from their weight, which is a real problem. Orthopedic problems, so there are conditions of the knee and hip that are related to weight. Sometimes we're even seeing fatty liver and even type 2 diabetes in kids. Yes. So it's definitely an issue, and it's not the child's fault. It comes down to biology and genetics and this environment that we're living in, but it's an issue for the family to tackle together. Not in a way that says, you're overweight, we need to get you on a diet, more in terms of what are some of the things we can do as a family to improve nutrition, exercise. So often for those kids, I'm like, let's get them in as much sport as we can, if they're that kind of child. And let's make activity a big part of what we do as a family. Limiting screen times. That's a big battle in our house. I'm sure it's
so how do we do that exactly?
Yeah. That's a whole other podcast.
That's a whole other episode.
So, in our family, we have a limit of 1 hour during the weekdays and 2 hours on the weekends. And then it's time to go outside, get out there and run around, kick the soccer ball, run around with the dogs. And then getting kids involved in preparing food. Yes. So let's go shopping. I want you to grab as many colourful vegetables and fruit as you can. Let's make some fruit kebabs and pop them on a stick. So getting kids involved in choosing healthy foods and, not eliminating treat foods. A lot of adults come to me saying, I was never allowed to eat treat foods as a kid, and now that's all I do is want them. So, just having some of those treat foods there occasionally. But making, ensuring that the family food nutrition is as best it can be, so, meat and 3 veg, 70s parenting comes back in again. Parenting, and limiting, juices and soft drinks and those sorts of things.
I completely agree with what you're saying, and I always think that it's never a good idea to try to change the behaviour by focusing on the behaviour. So if you're trying to support your children to be a little more healthy, then to not obsess about what they're eating, but to just make sure that the healthy food choices are there, and still have the treats. I bumped into my neighbour's son the other day, and he was so excited. He was just coming back from the little takeaway store around the corner, and he got his burger, and he has a burger on a Friday, and he so looks forward to it, and he walks down the street and gets his burger, and that's his, It's not every day, but once a week he enjoys it. And,
that's perfectly fine.
Yeah, absolutely. So any final words from you, recommendations or tips for our listeners on creating those good habits and particularly also being the example for their families in terms of how they live their lives?
Yeah, I think the first thing is to look at, well, where am I right now? How am I feeling about my health, and am I where I want to be? And if you're not, then looking at, where do I need to start? What's the thing that I can change that's going to have the biggest impact on my health? Because you can change lots of little things, but what's going to have the biggest impact? And if it's around weight, then it's probably going to be around food. So just looking at where you're at now and what's one small thing that I can change to have a positive impact there. But it's so hard to distill it down to 3 things because
it's the 3 things for that person.
Exactly. So I guess the message is that food's going to have the biggest impact on your weight. Get support. This is too hard to do it alone. It really is. And look, there are some people out there who can kind of do it on their own and they have great success, but that's probably more the minority. And this is, I guess my message is, this is a health condition like asthma, like diabetes. It warrants treatment. And it's okay to ask for help in that area. And then as a family, if looking at your habits as a family, then try to have like sort of the one meal for the family and not try to do 6 different meals, but maybe 6 variations of the one meal, and focusing on healthy habits as a family. What can you do to improve your food and nutrition in your house? Maybe it's that you don't buy as many junk food options. Like, I've bought that for if we get a guest coming over. I've got the packets of chips that are there for the kids, but whoops, I've eaten them myself. So trying to reduce what I call the food environment. If you've got these treat foods staring at you all the time, it's really hard. Big shop of fresh fruit and vegetables. Make sure you've got your stock items in your fridge and pantry that support you with healthy choices rather than having to deflect against the unhealthy choices all the time.
Wonderful, great advice. And of course, we will definitely put a link to your business and your website in the show notes if you want to have a look at more about what you do. But it's been so interesting talking to you, and I definitely think we should maybe make time for another one in the future.
Happy to.
So thanks for coming in today.
Thanks for having us today, Shireen.
Thank you.
My pleasure.